6 as Oregon tracks the Omicron surge of COVID-19. The focus is now shifting away from the soaring case counts.
To be completely transparent, we're likely approaching the maximum capacity of our testing system to identify cases. Instead, hospitalizations and deaths will continue to represent our most reliable and significant metrics.
Today, the Oregon Health Authority reported 13 new deaths, with 811 patients currently in the hospital with COVID-19. Right now, hospitalizations are about 31% below the peak of what we saw during the Delta surge.
Well, tonight we are digging deeper into this metric and how this surge is different. Fox 12's KANDRA has more on how hospitals are faring, as experts say the Omicron peak could be here very soon. KANDRA?
Yeah, that's right, Wayne. And as we get closer to the peak, I think the big question really remains is whether hospitals will get so full that they have to start turning away patients. We know that non-urgent surgeries at some hospitals have already been pushed back. We know the Oregon National Guard is helping support hospitals, staff in some hospitals. And this time around, people with COVID-19 in the hospital, they are not as sick as what we saw with the Delta surge. However, hospitals are saying that bed space is still a huge problem. We're midway through the month of January and just a week or two away from what experts believe will be the very height of the Omicron wave of COVID here in Oregon. More than 800 people in hospitals across the state have the virus right now, but the Oregon Health Authority says that number includes those who were admitted into the hospital for other illnesses or injuries unrelated to COVID. To look at the severity of the disease strain and its impact on hospitals, OHA says it's important to look at data showing the number of COVID-19 positive patients in the ICU and on ventilators. That number is roughly 150 patients staying in Oregon ICU beds, about half as many as there were at the peak of the Delta wave back in September.
The impression is it's more burden on acute care than on critical care, but this might only be a very brief kind of period. And then there's always a percentage of patients who need to escalate to the ICU.
And hospital capacity continues to be a huge problem. OHA says only 6% of ICU beds in the state are available, and fewer standard hospital beds are empty, just 5%. The number of available beds are tied to staffing. You can't have a patient without a caregiver, and those continue to be in short supply. Leaders with Providence Health Oregon say they are in, quote, extreme staffing shortages and actively managing all resources every hour of every day. That includes pushing back less urgent surgeries, especially those that might require a longer hospital stay for recovery. And the Oregon Health Authority today did tell me that they do not track people who are admitted into the hospital for COVID-19 because they are sick with it. So they're not tracking that specific number. Hospital officials say that those who are the sickest in the hospital with COVID-19 continue to be those who are unvaccinated. Reporting live tonight, KANDRA Fox 12 Oregon.